Hi, I'm Coach Love from runningwithdoc.com. Tonight in our video blog, we're going to be responding to a question that was submitted on the website regarding IT band syndrome. And IT band syndrome is one of the most common running injuries that we see in runners as therapists. Typically, most studies that look at overall running injuries have this in the top 5 of running injuries that occur. The knee is the most common place to hurt, and IT band syndrome is usually the second most common knee type of injury that we see. IT band syndrome is characterized usually by pain on the outside of the knee, even though the IT band runs all the way from the hip to the knee joint. With IT band syndrome, it's typical to have sharp pains, severe pains, most often occurring going downstairs and downhill during running. And the pain can kind of come and go during running. Sometimes when you warm up and loosen up, the pain goes away, but often you pay for it later on. In the past, it's often been considered a friction injury, which means we used to think that it rubbing over the condyle that it crosses caused a lot of inflammation and pain. But research hasn't necessarily shown that. Some studies have indicated there's swelling in that area and that friction might be a part of the cause, but other studies and have shown the opposite of that. And that's really the story with IT band syndrome in general. In the research, it's one of the most frustrating areas of running research because one study that's well designed will come out and say, for instance, that overpronating significantly has an effect on the IT band. But then another study, equally well designed, will come out and show that supination has an effect on it. So a lot of the studies have shown inconclusive results when you put them all together. But it's a common thing that we see. So what is the IT band? The IT band is a thick connective tissue that runs from the side of your hip all the way down to the knee joint. If you squeeze on your thigh with your fingers on the outside, thumb on the inside, the hard band that you feel is the IT band. I guess if you have a very soft IT band, that's a different story, but a lot of runners have some stiffness in that. It's a thick connective tissue, so it's not really muscle tissue at all. It's more of a variety of fascial type tissue, which we'll talk about a little bit as I talk about some things you can do for it, whether stretching it is a possibility or whether that's even helpful at all. Typically, the problem that we see is often related to the muscles in the hip. The tensor fasciae lata, or the TFL, is a muscle that inserts from the front of the hip, and then the glute muscles insert from the back. And these can provide some tension and pull on the IT band a little bit, even though it is that thick fascial tissue. So in the video blog tonight, we're going to be talking about different ways you can treat that at home on your own, and then also some anecdotal treatment recommendations that I have, because again, the research on it is very inconclusive at this point. So I hope that you're following along with all of the blogs that we're posting, hopefully once every week or two, and hope you enjoy this video blog.